what's just going on for me. The most interesting part of all this, to me anyway, is the role of my own mindful state. If I'm not authentically mindful in the relationship, the client's going to have a very hard time consolidating mindfulness into their experience. However, if I'm deeply dedicated to the present moment and reflecting authentically, over time, clients begin to reflect inner processes similarly and respond to our exchange in a deeper and more meaningful way. And with repetition, emotional material slowly shifts from being something triggering to being something we can both wonder about together in the relationship. And there's very little formal teaching involved in this process. Only the effort on my part to make sure that I'm present to the unfolding relationship and that I'm aware of my body, my mind, and my emotions, regardless of whether the person in front of me has been trained to be present in a similar way or not. So the question that I'm exploring with you today is, if I'm entering into a relationship with you, does my ability to be deeply present in the moment help you to be deeply present in the moment? And if so, perhaps mindfulness is less about an intervention or a technique to use in our relationships or in therapy, and more about a way of being in our relationships. So as mentioned, I am a dance movement therapist, but I came to the field with a 14-year history as a yoga therapist. And as I relay my experiences as a yoga therapist, I think it's important to note that many of my realizations and understandings about what I experienced in yoga were the result of my later training as a dance therapist. Without dance movement therapy's focus on the uniqueness of embodied and nonverbal relationships, I'm not sure I could reflect on my experiences the same way. I spent 11 years of my life living in Asia, studying Eastern philosophy and yoga in a very traditional manner, which means without any structure or clear understanding about what was going on. And while on this quest, I spent much of my time training at a free yoga therapy clinic held in the heart of Bangalore, India. Often, I'd be required to just sit and watch the teacher dish out prescriptive yoga in a language I could barely understand. And this was how I was expected to learn. And if you've ever read anything about ancient teaching practices in India, then you'll know this is kind of what they do. And for some, it takes years, sometimes decades, to establish trust, commitment, and rapport with the teacher. Only then were these skills or powers passed between guru and student. 5,000 years ago, during the birth of yoga and this guru-disciple relationship, the creators of this ancient practice knew nothing of dance therapy, attachment theory, or neurobiology. But they absolutely operated like they did. For years, I would return to that yoga clinic, and I learned so much more than simple movement combinations to heal a slip disc or breathing exercises to reduce diabetic symptoms. Through that relationship with my guru, I learned to be more like him, to be a healer who is present, compassionate, and kind. In essence, yoga was a practice to prepare a person for spiritual enlightenment. And that enlightenment only occurred with the knowledge that all is one, which means that you and I are interconnected and not separate, while at the same time we retain our individuality. And to achieve this level of awareness, we must tame the mind, which to me meant becoming aware of inner processes and how they impact external relationships. Dr. Daniel Siegel coined the term interpersonal neurobiology in his book, The Developing Mind, in 1999. Interpersonal neurobiology studies the way the brain grows and how it is influenced by personal relationships. He talks a lot about how the mind is a product of activity from the brain, but that it's also a product of our relationships with each other. When we enter into a relationship, we share a mind. In this very moment, we are sharing a mind. And when I walked you through that mindfulness activity at the start of my talk, we were sharing mindfulness. So to consider my earlier question, does my ability to be deeply present in the moment help you to be deeply present in the moment? If ancient Eastern thought and Dr. Siegel are right, then the answer is yes. So a client of mine with a 40-year history of drug dependence offered to share his experience of how our therapeutic relationship was influenced by this combination of movement and mindfulness. He said, "The establishment of trust is at the core of my being able to listen to the wisdom of my body, especially in the newborn days when I made my first decisive moves into the uncharted territory of life without intoxicants. And that by observing you and letting your energy wash over me when we did that first movement and mindfulness piece in our old group, I experienced trust, not only in you as a witness and mirror, but also within myself. I remember an inner muttering, this is different than anything else.